Today we are covering standard precautions, the absolute bedrock of infection control for the NCLEX. These are the minimum infection prevention practices that you must apply to every single patient in every healthcare setting every single time. The core principle is that all patients are potentially infectious, even if they have no signs or symptoms. The NCLEX will test your ability to apply this principle, not just define it. For example, a question might describe a patient admitted for a non-infectious condition, like a fractured hip, and ask what level of precaution is needed. The answer is always standard precautions. The trap is thinking that no precautions are necessary. You must treat all blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes as potentially infectious. Hand hygiene is the most critical component. The exam will test your knowledge of when to perform it. You must perform hand hygiene before and after any patient contact, after contact with patient surroundings, after removing gloves, and before performing an aseptic task. An exam question might ask for the nurse's first action upon entering a patient's room, and the answer is almost always performing hand hygiene. Proper selection of personal protective equipment, or PPE, is another heavily tested area. This is not about the patient's diagnosis, but about the type of interaction you anticipate. If you are going to be handling a bedpan, you need gloves. If you are irrigating a wound where splashing is likely, you need gloves, a gown, and a face shield or goggles. A select all that apply question might ask you to choose the necessary PPE for starting an intravenous line. You would select gloves, but not necessarily a gown or mask, as significant splashing isn't anticipated. The sequence for putting on and taking off PPE is a classic NCLEX topic. To remember the donning or putting on sequence, think of going from the bottom up. First the gown, then the mask or respirator, then goggles or a face shield, and finally, gloves are last. To remember the doffing or removal sequence, just remember the alphabet. You remove them in alphabetical order. Gloves first, then goggles, then gown, and finally the mask. This simple mnemonic can save you on a tricky question. Sharp safety is also crucial. The number one rule tested on the exam is to never ever recap a used needle. Questions will try to trick you with scenarios where the sharps container is full or across the room. The correct action is to activate any safety feature on the needle and immediately dispose of it in a designated puncture-resistant container. Do not walk across the room with an exposed needle or try to force it into a full container. You must also understand environmental cleaning. Any equipment or surface that is touched by the patient or used in their care must be disinfected. This includes blood pressure cuffs, stethoscopes, and bed rails. The exam expects you to know that these items can harbor pathogens and must be cleaned between patients. Finally, remember respiratory hygiene and cough etiquette. This applies to anyone in a healthcare setting, including staff and visitors. It involves covering your mouth and nose when coughing or sneezing, using tissues and disposing of them properly, and performing hand hygiene. Questions might test this in the context of a patient in the waiting room. Your role as a nurse includes educating patients on these practices. Standard precautions are your universal toolset. They are not optional and are always the first line of defense before you even consider adding transmission-based precautions like contact, droplet, or airborne.